My name is Flynn Trotman. I am a physiotherapist. I'm currently working as a frailty practitioner for Southern Health for the frailty support team, which helps manage people of an advancing age in the community. We accept referrals from GPs or ambulance paramedics, and we aim to go in and help manage people at home or put plans in place to send them to an acute hospital with an aim to pull them back out safely, as quick and safe as we can. The team that I work for now, we're geographically located pretty much in the middle of Bournemouth Hospital, Southampton Hospital and Salisbury Hospital. Sometimes hospitals aren't the right place for a lot of these people, and if they're not managed in their home correctly, then often they go into hospital and the outcomes for them are a lot worse. They come out and they're physically deconditioned, they're mentally deconditioned. By trying to manage people in their home and keep them at home, I really believe, and I've seen, people's outcomes are a lot better. Hi Ray.
Hiya Flynn.
How you doing?
We're living in an area in the New Forest where we've got a really high level of older people. So the demographics show that we've got one of the highest populations of people living with frailty. So living with a long-term condition that they're having to survive and having to get through, but with a terminal trajectory. And the idea of having advanced practitioners to support people through that is really important because at the moment often people are pinging in and out of various health facilities and hospitals. And actually they're only addressing one of their particular issues, but actually older people want somebody who can manage all of those issues and walk them through the pathways. And from a community perspective, so older people do much better being looked after at home rather than being in a bed somewhere in a hospital.
For our patients, being seen by someone in their own home, by someone that's got more than 10 minutes, 15 minutes to see them in a clinic appointment, makes all the difference, because we can really get to the bottom of what their worries are and what their needs are. And sometimes it can be as simple as who's going to put the bins out and who's going to feed my cat. And if you can't get past those big worries for people, they might not let you address the big worries for us, like their healthcare needs or their social care needs. Being able to diagnose and treat an illness, sometimes serious, sometimes minor, that enables a patient to stay at home, also means that we can reassure our colleagues in social care, so home carers, social workers, that the patient is well enough to remain at home, that they're being closely monitored enough.
Yeah, hi Dr. Lawrence, it's Flynn Trotman from the frailty team.
It's also really essential for our partners in primary care, so our GPs, that they've got someone that they can fall back on. General practice is under a huge amount of pressure at the moment, and there are thousands of ACPs working in general practice doing an absolutely fantastic job, but already their skills and their time have been sort of sucked up into what general practice needs, and it's all very surgery based, and very few of them get to go out into people's homes and provide care at the point where it's needed most. We're that bridge. Within our team, we measure and monitor everything. We're a new service, so we really do look at the fine detail of the number of patients we see. In the last year alone, we've seen over 1,300 patients as a team across the New Forest. Just under 17% of those patients have required a hospital admission. A year ago, our admission rate was at 25%, so we know we're pretty much at a point where only our very sickest patients that really need hospital admission do still go to hospital. Advanced clinical practice contributes to the system by relieving pressure in other parts of the system that allows the relieved part of the system to focus on the bits they really need to. The very sick, the very unwell. We need people that are trained in service improvement, and we also need people with leadership skills to be able to lead that service improvement. Having funding for Flynn to complete this training programme is really essential for our patients. Flynn already has a lot of great leadership qualities and a lot of management experience, but he does need to be able to consolidate that, to be able to put it into practice in a more fluid way.
What I'm most looking forward to is expanding my clinical knowledge and decision making, because I think at the moment I don't necessarily have the confidence to do that. I think with working in the education bit and working closely with the GPs and the senior consultants that I presently work with, I think I can get more confident in the decisions I make.
It's recognised that actually medical models don't really work in this. We're looking at a much more complex biosocial model. We're really wanting people who are clinical experts to manage people at those different levels of frailty. And that takes a very subtle switch from being a single-minded person who can do this, this and this, to somebody who's able to wrap around a person and find out what matters to them at that particular moment. I think it's really important that we're investing in this phase of people's lives. We all want to live as long as we can, and we all want this bit of our lives, should we get to it, to be as well resourced and well managed as possible. And having an advanced clinical practitioner who understands my needs, or my mum's needs, or my grand's needs, and is able to deliver the care in a form that they really need is absolutely fundamental. And I think crucial to us as a nation, as a community, really valuing older people, because after all, that's where we all want to end up, isn't it?